Welcome back. There's a range of treatment options for people dealing with back pain that can include injections from an interventional pain specialist. Kim Kaiser sat down with Dr. Mark Seidelmann, who works with many patients suffering from back pain.
Thanks, Michelle. I'm here with Dr. Mark Seidelmann, an interventional pain specialist, as you mentioned, and we're in one of the suites where patients receive interventional pain therapy. Thank you so much for being here today. So when might be a time when a patient would come to see a specialist like yourself and end up in this suite?
Well, generally the people we see here are ones that are referred by their physicians who have neck pain or back pain or radiating symptoms into their arms and legs. And so we can help with pain that's coming from various spots like that.
What sort of symptoms are patients typically experiencing that might bring them to see you? What kind of pain are they in?
Some people are in a lot of pain. They've had pain for many years. Other people have had pain just for short periods of time, and they are looking for relief.
So what kind of treatments are you able to provide?
We provide epidural steroid injections into the spine with cortisone type of steroid. We provide joint injections along the spine and into peripheral joints as well. We also do nerve ablation types of treatments to help alleviate joint pain also coming from the neck or the back.
Dr. Seidelmann, who would be a good candidate for these kinds of therapies?
People who have had perhaps disc herniations or injuries to various parts of their spine, or even degenerative changes, we can help alleviate their symptoms.
What kind of results do patients often see?
Oftentimes they can be very dramatic and very, very encouraging to them. Sometimes it may take a while, it may take a few injections, but the main goal is to help people feel better so that they can then re-enter their life and hopefully find ways of preventing them from coming back through exercise and other treatments.
So do patients sometimes have to come and see you more than once, or how often might a patient need an injection?
We like to limit the amount of steroid that a person would receive. We do watch how much somebody would get over time, and it's variable depending on where the injections are done and how much they receive.
Now, you also have a background in physical medicine and rehabilitation. How does that kind of treatment help patients and work with the pain therapies?
Physiatrists have an expertise in musculoskeletal medicine and combining all the components of functional use, how the body works, and how does that apply to the spine and the peripheral areas, the arms and legs and those sorts of things. So from a dynamic standpoint, it helps us pinpoint where we target our medications and our treatments. The physiatrists are also, we prescribe exercise. Exercise is really the primary component of any treatment form. These injections oftentimes are just a bridge to help somebody lower their pain and be able to participate in an exercise program that may help them long term.
Of course, many patients are trying to avoid a serious back surgery. Do treatments like these prevent the need for surgery or simply delay the possibility of surgery?
It depends. Even the surgeons want to avoid doing unnecessary surgery that may not help somebody. So these procedures can help, like you say, delay the need for surgery or even treat a problem that effectively enough so that somebody can avoid surgical intervention.
Why is it so important to seek treatment for back pain as opposed to simply living with it?
Seeking treatment, first of all, it can help diagnose what the problem is, finding out what can be helped and what is the best way to treat that. And so oftentimes an injection can not only hopefully help alleviate the pain, but also we can find out where the pain is coming from, and that helps everyone else target their treatments better.
If someone waits and their back pain becomes worse, does that mean that it might be harder to treat?
Not necessarily. We see people who have had pain for a long time and pretty intense pain, and there have been some very remarkable and dramatic improvements in people's abilities to cope with pain and to live their normal life.
It sounds like physical therapy and exercise are a very important part of a patient's overall treatment.
Exactly. That is very important, and that can't be stressed enough. People need to be in good physical condition to help stabilize their spine and support that so they don't develop the degenerative changes that lead to further problems. Oftentimes we'll see people, they'll have an injection and feel great and not do the other part. Well, they come back. And we encourage people to perform a routine exercise program, aerobic conditioning, and improvement of their core, stabilizing muscles.
Is there anything else that you'd like to add, Dr. Seidelmann?
Yeah, I've seen many people who have had pain for a long time. They haven't even known that there are options to treat their back pain, and injections can be a very important part of that. And again, have very remarkable and dramatic results for a lot of people, and so that's very encouraging.
Some great information, Doctor. Thank you so much for your time. Michelle, back to you.